The non-invasive therapy with Curodont Repair Fluoride Plus is as safe as its application is easy. The entire process of applying Curodont Repair Fluoride Plus is completed within 8 to 10 minutes without drilling, anesthesia, or pain. Prior to placement, perform oral prophylaxis and finish with a coarse prophy paste with or without fluoride. Activate Curodont Repair Fluoride Plus applicator, remove the black clip, and plunge the sponge into the liquid reservoir. Let the sponge soak in the liquid for at least 10 seconds. Apply 35% phosphoric acid to the surface of the early carious lesion for 20 seconds, and then rinse thoroughly. For interproximal lesions, use unwaxed dental floss to move or distribute the 35% phosphoric acid to the surface you will be treating. Rinse thoroughly and then dry. Be sure to keep the area isolated using a device, cotton rolls, dry angles, etc. Now you are ready to apply. Withdraw the saturated sponge. Squeeze the sponge on the treatment area to draw as much liquid as possible on the surface of the early carious lesion. It is not recommended to use a painting motion. It is important to note that only the sponge applicator must be used. The solution cannot be transferred to other applicators. Wait for 5 minutes using the saliva ejector as needed. Do not rinse during this time. The patient can semi-close their mouth if needed. Use this time to provide routine instructions and emphasize the need to maintain good oral hygiene. After 5 minutes, you can remove your barriers or isolation device and discharge the patient, instructing them not to eat, drink, or rinse for 30 minutes.